All right, going to this past holiday weekend, the message was pretty strong. We cannot have another Memorial Day. Do you have a sense of how we did? Any early feedback?
Well, it's premature to say right now. My observation, however, is that people contained themselves far better over the 4th of July than they did over a Memorial Day. We need to wait and see what the data looks like here in the coming days. But I think Texans in July, the numbers are far different than they were back in May. And I think the public was very much more concerned today because the number of hospitalizations, the number of people testing positive, and even the increase in deaths. So I think in general, our fellow Texans understood a whole lot more in July than they did back at the end of May about how serious the spread of the coronavirus is.
Yeah, I think that's for sure true. We got some new polling just out from Texas Politics Project at UT. You probably saw this, found 51% of Texans now think the efforts to deal with the pandemic are going badly, up from just 29% who thought that last time they did this poll in April. People who think Texas is doing well fell from 66% to just 29%. Do you feel that? Does that put pressure on you to consider doing more?
I think it's reflective of the facts that we were just talking about, and that is when polls were taken previously, the number of cases were very low. The number of hospitalizations were very low. Whenever you see an increase in the number of people testing positive, as well as an increase in the number of people being tested positive, all that kind of stuff, it's going to lead to more people being concerned about it. I share that concern. And that's exactly why I'm doing exactly what I said I would do early on when we began to open up. Remember, when we began to open up, I made clear that it would lead to an increase in the number of cases. That's been demonstrated in every state in the United States that's begun to open up, and also demonstrated in every country across the world. It's just the way a pandemic works without any treatment for the pandemic. But I also said that if the spread too much, it would be necessary to take measures to contain the spread, and that's exactly what we're doing. If all Texans work together and if the local governments will enforce the executive orders that exist, I believe that we can bend the curve. Now we can reduce the number of cases and we can build greater confidence among our fellow Texans about the status of COVID-19.
A little news today out of Houston. The mayor of Houston this afternoon officially asked the executive committee of the Texas Republican Party to cancel its in-person convention. That starts a week from Thursday in Houston. The mayor said it would be a virus super spreader event. He suggested a virtual session, potentially 6,000 attendees. You're the top Republican in the state, Governor. What do you think should happen?
I know that the executive committee for the Republican Party of Texas, they've been talking about this. I think they continue to talk about it, and they weigh all of the consequences, and including the public health and safety measures, obviously, but also weighing issues such as the business that needs to take place, understanding that this is more than just people getting together. There's certain official pieces of business that have to be taken for future action going forward, and I think they're balancing the two, and they will make a decision that's going to fit that balance.
You don't want to weigh in on what you think should happen?
Well, obviously, I think whatever happens, whether it be, listen, this convention or any action that anybody takes, we're at a time with an outbreak of the coronavirus where public safety needs to be a paramount concern, and make sure that whoever does anything and wherever and whatever they do, they need to do it in ways that reduce the spread of the coronavirus.
Okay, very good. Dallas County now has had several days of more than 1,000 cases each day, new cases. State Health Department, this is a question that we've been getting a lot from our viewers, so I want to try to nail this down if we can. State Health Department recently adopted a revised definition of probable cases, which greatly increases the number of probable cases. So some people believe that has created our spike, and we've been getting bombarded with people saying that. Has there been a reporting change on confirmed positive cases? Do those numbers now include probable cases?
Yeah. I'm glad you asked because the way the data is provided by the State Department of Health Services, it provides one column in one single category for those who test positive for COVID-19. It provides a separate column in a separate category for probable cases. The two are not intermixed at all. The reason why we are seeing a spike in the number of cases is because there are more people testing positive. If someone is tested positive, that means that they are confirmed positive. and the probable cases are a different category altogether.
Thank you very much for making that clear. Lastly, death rate declined over the past month. How significant is that compared with hospitalizations and the positivity rate to you?
I think I heard you say the death rate declined, and it did decline perhaps a little bit, but remember this. The 4 days leading up to the 4th of July combined were the 4 deadliest days that we've had during this pandemic. And so we need to see where things are going. Remember those who lost their lives just before 4th of July likely contracted COVID-19 in late May. Okay. That was before this big run-up and all the people who've been testing positive. My concern is that we may see greater fatalities going forward as we go into the middle part of July.
Okay, understood. Governor Greg Abbott, thank you for joining us. Thank you very much.